there's been so much media attention on this that some patients are just so upset and worried about it that they just want to get the implants replaced. And any patient who thinks like that, after seeing the evidence and after talking it over with her surgeon, wants to have her PIP implant replaced, even if it's not ruptured, should do so. But it's really important that you make that decision based on the evidence and not based on media scare stories. Patients with PIP implants basically have 4 treatment options. The first one is get an MRI scan to see whether or not you've got a leaking implant, and the college would recommend 100% to all women with PIP implants that they do that. Once you've had the MRI scan, you will know whether your implant is leaking or not. If the implant's leaking, it needs to be removed. Not as a matter of extreme urgency, but you need to talk to your doctor and plan to get that removed sometime in the next few months. If you have it removed, you could simply have it removed and not replaced. That's a fairly simple operation, fairly low risk. Or you can have it removed and replaced with a different kind of implant. That operation is not so simple. In many cases, it's actually quite difficult. It may be necessary to remove some of the capsule, the membrane around the implant, for example. Not always, but it may be necessary. It may be necessary to change the shape of the pocket to fit the new implant. And you need to know that when you do replacement surgery for any breast implant, not just PIP, the complication rate is higher than it is for the first time that you had breast implant surgery. That's the complications such as infection, movement of the implant, capsular contracture. The other thing that is important to understand with replacement surgery for any reason with any implant is that the results are less predictable. So it's more difficult for the surgeon to tell you what you're most likely to look like after the operation if it's a secondary surgery. Because replacement surgery is more risky and the results less predictable than for first go surgery, it's really important that you weigh those things up before you make a decision to have replacement surgery. If your decision is to have your PIP implant removed and not have it replaced with another implant, it's difficult to say with certainty what your breasts are going to look like. It depends on a number of factors: how large your breasts are, how long you've had the implant in, and how old you are. It's a bit like when a woman breastfeeds. Their breasts get larger and then they shrink again after breastfeeding. Some people go back to being pretty much like they were before and others don't. And that's what happens with breast implants. Some patients will have breast implants removed and apart from there being a scar, obviously, where the implant was put in and taken out, they look pretty much the same as they did beforehand. Other patients will have more sag and so on in their breasts. So the best way to determine what you're likely to look like if you have a removal without replacement is to discuss that with your doctor for your own individual circumstances. A question that some patients ask is, will I have any extra risks once I've had the PIP implants removed? And the answer to that is no, because the gel inside the PIP implants has been shown not to be toxic. So if you have the implants removed, you're in no different a position to a patient who has had another brand of implants removed. So just like any other woman who's had breast implants removed, or indeed a woman who hasn't got breast implants, the ongoing monitoring would be self-examination every month after your period and a mammogram every couple of years once you reach the age in your state that mammography is offered. Those are the options for patients with a ruptured implant on MRI. But what if the MRI shows no rupture? Well, you still have those options. You could have the implant removed, or you could have the implant removed or replaced. But you have another option, which would be watchful waiting. We will find out over the next few months what the true rupture rate of PIP implants is, so we can tell somebody that hasn't got a rupture, well, you've got X% chance of rupturing by 10 years compared with other implants. There's really no great risk in the watchful waiting because we know that PIP gel is not toxic. And if the implant isn't ruptured, then there's no immediate need to do anything unless you want to. If you decide not to have your PIP implants removed, then really you need to be looking for the same signs and symptoms as a patient with any other brand of implants. Anything that worries you, unexplained pain, unexplained lumpiness, for example, movement of the implant from the position it was in before, a hardening of the breast, those are the kind of symptoms that you should go and talk to your surgeon about.